All right, good afternoon, everyone. My name is Kyle Rojas Legleiter. My pronouns are he, him, and his, and I'm the Senior Director of Policy and Advocacy at the Colorado Health Foundation, which means I might be a familiar face if you've been to one of these gatherings of advocacy grantees of the Colorado Health Foundation before. So if you are a return visitor to these convenings, welcome back. And if this is your first of these kinds of convenings, welcome to us trying on something new and doing this in a virtual way for the first time this year. As with many things in 2020, our plans for gathering you all in the spirit of fostering community, connections, sharing ideas, laughter, and support with one another is happening in a slightly different format and style today than we originally envisioned how this would go for this year. So we appreciate you bearing with us and joining us for this adventure this afternoon. And we hope that this will be an enjoyable part of your afternoon and give you a lot of good opportunity to maybe see some faces that are already familiar to you in the Zoom box you see on the side, or maybe to meet and connect with some folks that you might not have already crossed paths with before, or have not crossed paths with in a while, since we're all sort of still in pandemic mode and gathering in person less frequently. Again, we appreciate you joining us here today. Amy, if you don't mind clicking over to the next slide, I'll start with just some introductions of some of the other folks that you'll be hearing from during our time together this afternoon. You'll hear from some of my colleagues at the Colorado Health Foundation, and I want to thank and acknowledge a small group of us who've put a lot of thought into gathering feedback, gathering perspectives from all of you about how to make these a productive use of your time and an interesting sort of space for you to gather and to connect with one another. And those colleagues of mine at the foundation are Rose Green, Sarah Manji, Jace Woodrum, and Austin Montoya. And I also today have the pleasure of introducing a relatively new colleague of ours at the Colorado Health Foundation, Scott Downs, who joined us a couple months ago as a senior program officer, who's going to be my partner in crime in the advocacy priority of the foundation. And Scott, I'll turn it over to you to unmute yourself and do a quick introduction of yourself as well.
Hi, everyone. I think just looking through the participant list, I think I've had the pleasure of working with and meeting many of you in past roles and with past organizations, and looking forward to working with you as part of the advocacy strategy, as well as other work the foundation is engaged in. Very happy and excited to be joining Kyle and the rest of the advocacy team as we move forward in some uncertain times, but a lot of positive and a lot of positive work ahead. So excited to join the team. I started in March, and it's been a roller coaster ride ever since, given everything that's going on, and just really happy to be part of the team and look forward to working with you all.
Great, thanks, Scott. I also want to thank and introduce the dynamic duo of two Amy's, Amy Diet and Amy Dillon, who together are a firm called Advancing Dynamic Solutions. They will be your facilitators and MCs for today, and they helped us in planning out pivoting from what we thought would be an in-person event to now this virtual one, and doing that hopefully in a way that, like I said, creates a productive space for you all as well. And any of you who know me know that event planning is not my strong suit, so I'm really glad to have the Amy's by our side to help us to execute this as well. And then you'll also be hearing from some of our colleagues at Innovation Network, which is the learning and evaluation firm that we've contracted with to be not just our learning and evaluation partner in the advocacy work that we're supporting, but your learning and evaluation partner in making sense of reflecting on the work that the advocacy ecosystem for health equity in Colorado is doing as a whole. And a big part of what we're doing today is going to be reflecting back a lot of what you told them about your work in the form of a survey that we put out to you a handful of months ago. So without further ado, I'll turn it over to the Amy's to pick up their MC role and walk us through what to expect for today.
Thanks, Kyle. Good afternoon, everyone. I'm Amy Diet. I'm one half of AD Solutions. My counterpart, Amy Dillon, you'll hear more from a little bit later today, but we've had the pleasure of facilitating these advocacy grantee meetings for just over a year now. So it's nice to see so many of your faces again, and welcome to all of the new faces. I want everyone just to take a deep breath. Online events are hard, and all we've been doing are Zoom meetings or other online meetings for quite a few months now. So we really want this to be an opportunity where we can all come together in a space to say hi, to see each other's faces, to network, and really just to join in during this pivotal time for all of our advocates. We have heard you, and we've put together an agenda today that we hope you will see as a meaningful use of your time, where you can connect and you can dig in on the pressing issues that we all are facing and seeing across the world today. It's so nice to see everyone, and we look forward to really digging in today. I'm going to start with just a few tech tips, because everyone has been using different platforms, and we want to make sure that everyone knows just where things are. So just real quick, bear with me. You have some audio and video controls that are down to your lower left. If you hover over, that is how you unmute or mute yourself. That's how you start or stop your video. Two other important buttons I want you to know about. One is the participant button. So if you look down, you should see the participants. It should say how many people are here. We have 41 people with us right now. And that's where you'll be able to see your name as well. The other important button is the chat function. So you should also see the chat function. So if you would click on that and open it up, we are going to use the chat box to send you links to different documents to open. That's also where you can obviously please place any questions that you may have. If you look in the chat box right now, we actually put in the link for the meeting agenda. So if everyone wants to click on that and open it up, that agenda has all of the different links we're going to use today in one place. So when we go into our small groups, we have a place that helps you guide through that. And when we have the discussion around the data presentation that we're going to have, we have some additional slides for you to look at in case you need to refer to those later. So that's my really quick tech tip. Just for something fun, if you do look on participants, you can raise your hand. You should have a little reaction button where you can give people a thumbs up or a high five. Those are always fun little features that we have. So proposed norms. As always, assume positive intent. Whenever you're in an advocacy space, we may have people coming from all different areas, and the way that we want to utilize these meetings is we're stronger together. Some of our diverse ideas may actually open up our minds to different ways to think of things or be able to put ourselves into others' shoes. Help create a safe space. We are recording the main piece of this meeting, but when we go into small group discussions, those are not recorded. We are not going to have facilitators or Health Foundation staff join you in those small group discussions. We really want it to be an opportunity for you to dig in with your colleagues around some of these, somewhat controversial and or private topics that you want to talk about. Respect others. We are all here. We're all passionate individuals who really want to make a difference in this world. Seek clarification when needed, especially on an online event. If there is something that's not clear, or if you're having a tech issue, please don't hesitate to write a chat, and we will definitely help you out in any way that we can. Take care of you, especially right now in the Zoom environment. Staring at a computer all day is not fun. So stand up if you need to, turn off your video if you need to, take a minute for yourself. We will have some breaks during this. It's an hour and a half staring at a computer. So if you need to go to the bathroom, or if you need to, help your dog or your child or get a drink, please do so. And then finally, connect with other organizations. One of the main goals of this meeting, and even though it's virtual, is still to connect with and learn from each other and learn about maybe an organization that you haven't worked with very closely in the past, or maybe it's a colleague that you just haven't been able to see in person for a while. So those are our norms. I'm going to give you a pop quiz on my tech tips. If you can find those reactions and you want to give me a thumbs up, feel free to do so. Yay, good job everyone, that's great. Meeting objectives. So like Kyle said, you all plus many other organizations participated in an ecosystem survey, and we promised that we'd share those results with you. So we will give you the presentation today of the results of that ecosystem survey. We are then going to dive in and identify how those results relate to your organization's advocacy efforts, and then really dig into a discussion around the current ecosystem and the impacts of not only COVID-19, but racial injustices, and really be able to talk about how has this changed your advocacy approach? What supports do you need now, especially now? And what does this look like for you? So those will be our meeting objectives. And again, this is based off of some of the quick surveys that we sent out after deciding to cancel the in-person event and go to a virtual event. Meeting agenda, we have our welcomes and introductions, which we're going to finish up in just a minute. We will then do, like I said, the presentation of the ecosystem survey results. We're going to dive into those small group discussions, and we have some specific discussion questions to help you along. And then we'll do closure and next steps. Part of the next steps is looking at what the fall will be, and we have a kind of new proposal for you of what the fall meeting or meetings could look like, especially in a virtual setting. So that's what our day looks like together. And again, the agenda has been put in the chat box, so if you want to open that up, you have a bunch of links in there. All right, introductions. So we're going to try something new. Bear with me if it doesn't work well. When you have, over 20 people even trying to chat their names in the chat box, it just doesn't always go well. And with such a large virtual convening, you will have a chance to introduce yourself in your small groups in a more detailed and meaningful way. What we're going to do is what we're calling a rename activity. And we're only calling it that because that's what Zoom calls it and makes it a little easier to walk you through it. So if everyone could open up and click on the participant button at the bottom, it should open up the long list of names of everyone who's on this meeting today. If you hover over your name, you should get two blue buttons, one that says mute and another that says more. If you click on more, you can then click on rename. That should open up a new box. So what we'd like you to put in this box is your name, if you don't already have it listed in the way that you want people to see it, your organization or an abbreviation of it if it's a really long name, and then your pronouns. So he, his, she, her, they, theirs. And what we're hoping this will do is as people talk, and especially in the small group, you can see who people are, what organization they work for, what their preferred pronouns are. So it makes it a little easier to connect after the fact, which we will be sharing a list of participant contact information afterwards. So I'm going to give everyone a minute to go through that. If you have any questions, please don't hesitate to put them in the chat box. This is great. Thank you, everyone. Perfect. So now we're going to do a little bit of what in an in-person event we'd call the stand up or wave your hand activity, but we're going to find out who is here and who's in the room, if you will. So oops, we're going to do a quick poll. Let's see if I can open this up. Now I'm going to warn you, this is going to make you think a little bit. We tried to think of some options that were a little bit dichotomous to really make you kind of think about what does my organization really do and who do we truly serve. We do have the option to allow some flexibility of both, if you will, but I'm going to start a poll and it's going to show up on your screen and you're going to choose the answer that makes the most sense for your organization. And we're going to see who's here today. All right. It looks like everyone's taking the poll. Looks like we have a few more who still need to do it. I think we have about 5 more people who haven't taken it yet. I'll give you just another minute. All right, let's see what results we have. So it looks like out of the organizations that we have here, see if I can share the results. We almost have an even number of about 16 organizations that work on statewide actions. That's where they spend the majority of their time. About 5 that spend the majority of their time on local actions, and about 14 that spend the majority of their time on both. We have about 18 or 51% of organizations that work more, the majority of their time at least, in urban or metro areas, and 16% that work on both. It looks like we have one Lone Ranger that works solely, mainly, I guess, in the more rural frontier areas. So thank you for being here. And finally, as far as advocacy approach, looks like we have just about an even number who spend the majority of their time on legislative advocacy, as well as community engagement and organizing, and then about 54% that do both. So thank you so much for doing that. And thank you again for being here today. So I'm going to turn it back over to Kyle for now to give us a little bit more information about the Health Foundation and what they're doing right now.
Great. So thank you again, Amy. So just a quick crash course on the Colorado Health Foundation, because we know that some of you are familiar with us and others perhaps less so. And so the most important thing for you to know about us is our mission, which is to improve the health of people in Colorado. And having a mission is really common for nonprofit organizations. We also have something about our identity that is relatively uncommon. We call it a rally cry. And for us, our rally cry is bringing health in reach for all Coloradans. And Amy, if you go to the next slide, I'll unpack that and what that means a little bit more for us at the Colorado Health Foundation. That means that we also have something that's also relatively unusual in the nonprofit world, and that is these things that we call cornerstones. And we think of these as core elements of our identity, core features of all the work that we do at the foundation that really center us, that we try to hold ourselves accountable to achieving and really reflecting in our actions. And there's just 3 of them, our cornerstones. And the first is to really live out that rally cry of bringing health in reach for everybody in our state. That means that we need to center health equity and do everything with the intent of creating health equity. So that means being deeply reflective about what life is like on the ground for people across the state of Colorado and how that might look different depending on who you are and where you are in the state. And to really listen acutely and attentively to the Coloradans that we seek to serve. And those are folks who are living on low income and historically have had less power and privilege in our state. And then the final element of our cornerstones is that we are informed by the community and those that we exist to serve in everything that we do. And we sort of represent this with these interlocking circles because we believe that these are mutually reinforcing activities. If we truly center health equity in everything that we do, that means that we're centering the voices, the lived experience of people who live on low incomes and have not had power and privilege, and that listening to and deeply engaging with folks in the community and the folks that we exist to serve is deeply important to us in all the work that we do. We're gathered here today to focus on one specific strategy, one specific element of the broader work of the foundation, and that is our work to amplify health advocacy for health equity in Colorado and to focus on influencing the actions of the public sector, whether that's local entities like city councils, county commissions, school boards, state level government, or the federal government in Washington, D.C. Amy, if you go to the next slide, you'll see a quick graphic of how we're conceptualizing our strategy around influencing public policy and our work alongside all of you and the advocacy ecosystem in Colorado about what we see as contributing to sort of the conditions for fruitful public policy that actually reflects the voices, the interests of the folks that we seek to serve at the Colorado Health Foundation. And we sort of think about this in three ways that are not sort of siloed in the way that you see these on the slide here, but are actually hopefully mutually reinforcing and mutually supportive. And so it starts with supporting other advocates. So that's all of you here virtually today and other colleagues around the state as well. So providing funding and other kinds of support to organizations who are doing the work on the ground advocating for health equity. And what we're doing today in this sort of gathering of folks like you with other colleagues is one example of what those other types of support, in addition to dollars from the foundation, that we're seeking to provide to strengthen the connections in the advocacy ecosystem out there. The second element of what we're doing under advocacy is leveraging the foundation's own voice and our own ability to have an influence over public policy too. So that means that we're not necessarily shy as an organization about taking a stand on issues that are important to health equity. You'll see us over time speaking out about things that are important to Coloradans, that are important to health equity and their lived experience. And we see that as part of our role as being an actor in the ecosystem alongside all of you, complementing the work that you all are doing as well. And then the third and relatively newest piece of this work is work to really deeply understand the perspectives of Coloradans. And that is taking the form of a lot of public opinion research and efforts to really generate better insights into Coloradans' values, beliefs, and opinions that helps us to better understand the mindset of the people in our state, how that varies across different people in our state, and what that means for how we and other advocates can communicate effectively and persuasively, not just with people who already agree with us, but people who might have different perspectives and different points of view about policy issues that relate to health equity as well. And if you've been to some of these convenings before or paid attention to communications from the foundations, you started to see bits and pieces of this work, and this is work that we want to engage in alongside you all with as well. And so you've seen, for example, public opinion polling that we've started to share transparently with you all and other actors in the state of Colorado, as well as a body of work that's about deeper, more qualitative research that truly listens to people in more open-ended exploratory ways. And you've heard bits and pieces of that in some previous convenings from our colleagues at Wonder Strategies for Good and Goodwin-Simon Strategic Research, who've shared what they call the hardwired approach to listening to folks and translating that into effective and persuasive communications for advocacy. So as I said, we see these as sort of three interlocking pieces of a broader strategy. So we hope that the pieces come together and are more than just the sum of their parts. And a lot of this means us working alongside you, listening deeply to you and the connections and community that you all have, and you're supporting the work, amplifying the work that you're doing as well, not just through funding, but through opportunities like the one that you're participating in today to build those connections across the ecosystem, to maybe pull up from your day-to-day work and engage in some conversations with your colleagues about the bigger picture view about the ecosystem in Colorado, which is really the heart of the conversation that we're about to have with our partners at Innovation Network about what we heard from you all and your points of view on the advocacy ecosystem in Colorado and what that means for your opportunities to do good work to move your mission forward, whatever your mission may be. We'll come back at the end to talk a little bit more about what's sort of happening at the foundation now, what's on the horizon. If you have questions for us at the foundation, feel free to chat those to us in the chat box throughout your time here today. We're happy to address those as we're able to during the time today, but always curious what's on your minds as well. So feel free to use the chat box as an opportunity to put things out there for us as well. And I'll turn it back over to the Amy's for the next piece.
Wonderful, thanks Kyle. I'm going to turn it over to Laura from Innovation Network to give us the results of the ecosystem survey.
Great. I'm going to share my screen. Give me one moment. All right. Is everybody able to see that and hear me? Take that as a yes. Thank you, Amy and Kyle. So I'm Laura Lehman from Innovation Network. I've met some of you at previous convenings. So we're the learning partner for this initiative, and we're excited to share some of the findings, not all of them because it was a lot of information, from the ecosystem data that you all participated in, a lot of you participated in, along with other advocates in the ecosystem. I'm also joined by my colleagues Lilit Hakobian and Johanna Mariu, and Lilit's going to help me share this information as we go through. So as you know, the foundation is working to support an equitable and inclusive ecosystem. And the purpose of this work was to start to build out an information base about the advocacy ecosystem in order to inform the foundation's work, as well as share and foster discussion about how this collective ecosystem appears to different actors, different stakeholders, you all, and then to help to target future efforts towards shifting power towards those organizations that are really led by affected communities. This work was done obviously before COVID, before some of the uprisings that are now happening, but I think it's pretty timely as well in terms of understanding kind of whose voices are centered in this ecosystem as we see it now, and discussing some of the questions that you all will get to dig into in your smaller groups. Just a quick note on methodology. You all received a survey last fall, and we, based on responses from the first group of survey respondents, we sent it out to additional partners so that we could kind of snowball and add on more respondents who are farther from the foundation and have less connections. So we ultimately received 125 responses to the survey, and this focused on some main topics. One being who advocates seek to serve and represent, who is represented and informs decisions within organizations, how advocates do their work, and what partnerships look like in the network. And today we're just going to talk through 3 of these sections, looking at priority populations and communities, who's really being served or who do organizations seek to serve, advocacy tactics and targets, how are you all doing your work, and networks and partnerships. Just to give a very high level overview of kind of the profile of who answered the survey, a little less than half of respondents say they focus primarily on advocacy. So it sounds like a lot of advocates, a lot of organizations working in the advocacy ecosystem do a lot of different things, including service delivery and other things. In terms of resources and budget, 70% of the organizations reported organizational budgets from around $100,000 to $2 million, while there were, a good amount of organizations above that as well. Geographic focus, I think we saw this in the beginning poll that you all took just now on this call, but most organizations, 60%, say that they focus their work statewide in Colorado. Of those that don't, the majority are focusing on 10 of the state's 64 counties. So these are the counties in blue on this map. You can see that Denver is concentrated along with a couple of counties around it. And then 23% of respondents said that they work in counties that are seen in gray on this map. And that's counties that were named by 4 or fewer advocacy organizations that were kind of considering to have a sparse presence. According to this data, there might be advocates there who did not respond to the survey or we haven't contacted, but that's kind of an area for further exploration. And then lastly, we asked about issue areas to frame, the rest of our findings as well. And we found that the most prioritized issue areas reported in the ecosystem include healthcare, economic opportunity and mental health, and safe and affordable housing. So I'm going to pass it over to Lilit to talk through priority populations and communities.
Thanks so much, Laura, for the introduction. So over the next couple of slides, we'll talk about priority populations. These are the racial or ethnic groups or lived experience groups that organizations said they seek to serve or represent. So the Colorado Health Foundation believes that a strong and healthy advocacy ecosystem is one that serves and authentically represents communities that historically have had less power and privilege. These include diverse racial or ethnic and lived experience groups. To develop a greater understanding of who the ecosystem prioritizes, the survey asked about 2 main things. First, we asked which racial or ethnic and lived experience groups organizations seek to serve or represent. And second, we asked how they engage with these prioritized groups. So looking at racial or ethnic groups that organizations prioritize, most organizations report that they actually do not serve or represent any particular racial group. Out of the ones that did report serving racial or ethnic groups, almost half reported serving Hispanic or Latinx communities, and about a third reported serving Black or African American communities. For this particular question in the survey, organizations could select more than one group, so there may be overlaps in some of the categories. So across all responses, almost half, 44% of organizations prioritize communities of color. Respondents also were able to select the lived experience groups that their organizations prioritize, such as individuals with disabilities, older adults, individuals who have low income, or workers or employees. As you can see in the figure on the slide, most of the organizations reported serving individuals who have low income or low wealth. And respondents also largely reported serving youth or children, immigrants or refugees, and individuals living in rural areas. Very few organizations reported serving individuals who are veterans, young adults, or individuals who are uninsured or underinsured. So to understand the second question in this section, which is how organizations engage with priority populations, we asked whether they are led by, working with, or advocating for their prioritized groups. Led by was defined as having a significant portion of organizational leadership and staff from the prioritized population, or having a membership or base from the prioritized population in decision-making roles. Working with is defined as working directly with the prioritized population or having a membership or base inform or influence organizational priorities. And advocating for is defined as not directly working with the prioritized population, but advocating on their behalf. So looking at engagement with racial or ethnic groups that organizations serve, respondents most often reported working with and not being led by or advocating for these groups, meaning that most of the organizations in the ecosystem may have some staff or board from their prioritized racial or ethnic groups, or may have a membership or base that informs organizational priorities from these groups. However, prioritized groups do not have a decision-making role within these organizations. So for example, if you look at the figure, 60% of organizations that prioritize Blacks or African Americans work with this group, while just 17% are led by this group. Organizations that served Hispanic or Latinx communities reported being led by these communities much more frequently than organizations did who served Black or African American communities and other communities of color. As you can see here, for example, 36% of organizations reported actually being led by Hispanic or Latinx communities. So moving on to the next slide. When we analyzed organizational engagement with prioritized lived experience populations, we found that respondents more often reported working with their priority lived experience populations, again, rather than being led by or advocating on behalf of these groups. However, with one of the lived experience groups, which was women, organizations were more likely to be led by women than to work with them. And Laura will review the advocacy targets and tactics.
Thank you, Lilith. As I said before also, so there's a full report of this information that you also will have access to, and it goes more in depth on certain areas, but so we're doing an overview here. But for advocacy targets and tactics, the foundation believes that a strong and healthy advocacy ecosystem should be able to target different branches of government at the local, state, and federal levels, and effectively engage in a range of strategies and tactics to achieve its goals. Not just to advance on certain issues, but to have a voice and power in the policymaking landscape in Colorado in general on all issues of health equity. So to get at this, we asked two main questions. Where do advocates target their advocacy work? And what tactics do they engage in? And how skilled are they at these tactics? So starting just with targets, we found that advocates are more focused at the state level overall, with fewer working at the federal level, which reflects the poll as well that you took in the beginning. And across each level of government, you all seem more focused, or advocates in general are most often targeting the legislative and executive branches. In analysis, we broke out organizations that specifically serve communities of color compared to the larger ecosystem. These are shown here in green. And found that these 50 organizations report targeting the state and federal levels less than the larger ecosystem, while being closest to the larger ecosystem trends at the local level. So some of you might be familiar with the advocacy strategy framework. I'm just going to talk through what it is in case for those who maybe are not. But to gain a better understanding of which tactics are most represented in the ecosystem, we asked respondents to rate your skill sets across advocacy tactics focused on the public, influencers, and decision makers. And these are mapped against the changes that you seek to to effect with the different tactics, starting with awareness, building, understanding that a problem exists, building this awareness, to will, building the will to act, believing that acting is important and that it can have an impact, and then pushing for concrete action. So when we map the findings of the data we got back from the survey of, what tactics are organizations most engaged in and how skilled are they at these tactics, this is what it looks like mapped against this framework. Looking at this, the circle size represents the percentage of organizations that are engaging in that tactic. So larger circles mean more organizations are using that tactic. And then the circle color represents the level of skill, self-reported skill from beginner to advanced. So the darkest blue is the highest skill set, which is intermediate because people did not rate themselves as advanced most often. And then the lighter blue is kind of developing to lower intermediates, the next highest skill set. And then green represents more beginning or lower developing skills on average across the ecosystem. So you can see here that what we have highlighted are the tactics that are more focused on influencers and decision makers. And just looking at trends, these circles tend to be a little bigger and a little darker. So it kind of looks like the ecosystem is stronger at these tactics and is more often engaged in tactics that are focused on influencers and decision makers. And you can see that, influencer education, 94% of advocates say that they engage in this and that they have pretty strong skills in this. In contrast, fewer advocates report high-level skills on tactics that target the public overall. These circles are smaller and lighter in color, especially when they're moving towards action. So you can see that there's kind of higher engagement in leadership development of community members and higher skill level there. But for storytelling, while a lot of people are engaged in this, they may have a lower skill set as self-reported. It was also an option to say that you rely on partners for these efforts instead of engaging in them yourselves. And 3 of the highlighted categories here are things that a lot of people said that they rely on partners for. So public polling or opinion research, legal advocacy and litigation, and voter engagement. And as Kyle said, public opinion research is one of the things that the foundation is engaging in a little bit more, kind of filling in a gap there. So this shows some of the gaps in the ecosystem. The next couple of slides show similar information, but this is broken out for organizations that prioritize communities of color, again, to see how are organizations prioritizing communities of color different from the larger ecosystem. So the blue circles are the larger ecosystem, so that's the same percentage of engagement as you just saw on the previous slides. The white circles represent organizations that are serving or representing communities of color. On average, they have an average about 10% less engagement across the larger ecosystem across tactics that are focused on policymakers. So you can see that there's quite a gap between organizations serving communities of color and the larger ecosystem in terms of which tactics they say that they're engaged in. And this does not reflect skill set, but just engagement at all, with the biggest gap in direct lobbying. This trend repeats on this next slide, looking at tactics focused on influencers and cross-cutting tactics. Organizations that seek to serve or represent communities of color report an average of 10% less engagement than the larger ecosystem across these tactics, with the biggest gaps in coalition building and policy analysis and research. And then lastly, this trend actually shifts a little bit for tactics focused on the public. In this case, organizations that prioritize communities of color engage about the same as the larger ecosystem or actually more. So the notable gap here is actually that organizations prioritizing people of color engage about 10% more in direct action and protests, and slightly more in movement building, leadership development, and some other tactics than the larger ecosystem. So Lilith's going to share just the last part, looking at networks and partnerships.
Okay, so if we move to the next slide, Laura, as the previous slides reflected, a strong advocacy ecosystem contains many different roles and perspectives, but also should be one that is able to collaborate, share resources, and take collective action, and one in which the voices of the communities that historically have had less power and privilege are centered. So to build a greater understanding of which organizations are more likely to collaborate, share resources, or hold power over decision-making in shared spaces, the survey gathered network and partnerships data by asking respondents to list up to 5 advocacy partners or coalitions that their organizations view as their key partners. And then afterwards, we analyze their responses against the rest of the data to identify characteristics, perspectives, and priorities of organizations more or less central to the network. So the resulting network data serves as a reference point for developing an understanding of advocates, their relationships, and how the network structure supports or constrains advocacy. The advocacy ecosystem overall included 350 organizations and 438 connections. The slide here shows the ecosystem network at a very high level, with organizations that are centrally located in the network and organizations in the periphery of the network. Those that are more centrally located are more likely to be connected to one another. So as you can see, the light blue circles represent organizations that serve people of color. I don't know if it's showing up well here. The dark blue circles represent organizations that are both led by people of color and that serve people of color. The yellow circles represent organizations that are neither led by people of color nor serve people of color. And the gray circles represent organizations that are missing data. This likely means that they were listed as a partner by an organization, but did not complete the survey themselves. So in general, organizations that are serving people of color are essentially located in the network as organizations that are not serving these communities. So in the following slides, we'll share some of the findings about characteristics of more and less central organizations in the network. When we looked at the data, we found significant differences in terms of issue areas, geographic focus, meaning serving sparse counties or not, lived experience populations, organizations being led by people of color, and advocacy targets. So looking at issue areas, we found that organizations that focus on issue areas including fiscal and tax policy and reform, democratic representation and participation, early childhood education, and economic opportunity were more connected than average. On the other hand, organizations that focus on issue areas including environmental health and justice, homelessness, civil rights protections, and anti-discrimination were less connected than average. When we looked at the organizations that worked in sparse counties compared to the overall ecosystem, we found that organizations working in these counties are less connected to the network. And just a reminder, we defined sparse counties as those that have 4 or fewer organizations working there. So we also looked at the centrality of organizations seeking to serve different lived experience groups. Overall, we found that organizations seeking to serve families, individuals who are uninsured or underinsured, individuals who have chronic illnesses, individuals who are workers or employees, businesses, individuals who are parents or guardians, and women are more connected, while organizations who serve or represent individuals who are LGBTQIA, individuals who are experiencing or have experienced homelessness, individuals who have been justice involved, and individuals who are veterans are less connected. Organizations that seek to serve communities of color were about as central as organizations that did not. But when we compared organizations that were led by people of color with the entire ecosystem, we found that organizations that are led by people of color are less connected than the average network. And finally, comparing levels of connectivity by advocacy targets, we found that organizations working at the state level of government are more connected than the network average. So that concludes our short slides with some of the findings. Thank you so much. I will switch it over to Amy so she can lead the next portion of our webinar.
Thank you, Lilith. I'm going to stop sharing my screen. There's a lot of information in a short time. We don't have time to chat about it. Go for it, Amy.
Thanks to our partners from Innovation Network for that presentation on the ecosystem survey findings. We're going to go ahead and jump into some small group discussion. We really wanted an opportunity for you to hear the findings from the ecosystem survey, but also had to have a chance to connect with some other advocates and have an opportunity to discuss these findings with them as well as some other timely topics. So I'm going to invite everyone to go ahead and open up their agenda. So in the chat box, we'll put the agenda one more time, if you're not in there already. And what you're going to do is you're going to open up the discuss results. So the agenda should be in there now. You'll see from 1:45 to 2:15, it says small group discussion. Click on discuss results. And that's going to take you to a Google document. And this is what we're going to be discussing today with your small group. In the agenda, there are also a link to the slides that were just presented by our partners at Innovation Network. So if you want to open those up, those are linked in the agenda as well. So what you're going to do is you're going to be invited into a small group. It'll tell you if you're in small group 1, 2, 3, 4, 5, or 6. Note that when you're going into your session so you know which number you're in. What you're going to do then is when you're in your group, you're going to introduce yourself, and then you're going to have a conversation around some discussion points that you'll see here on the screen now, and you'll see if you're in that specific document. So there's kind of 4 buckets of things that we're going to invite you to discuss, and we want you to take the conversation where it feels most authentic and meaningful to you. So there will be your overall reaction to the findings. So what were your reactions? What questions do you have? Do these data reflect your work and efforts? That's part of a conversation. Another topic area would be using the information. So how might these findings benefit or support your organization or advocacy efforts? And what else do you wish you knew about the ecosystem? And again, there will be a full report that's shared in addition to these slides following the presentation today. And then we have 2 additional topics related to COVID-19 and racial justice that are really timely topics for all advocates right now. So thinking about if there's anything fundamentally you're doing different with your advocacy work right now, and if there are any supports or partnerships you need. And then again, how your organization is addressing racial injustice and any supports or partnerships you need in that area. You'll see then there are sections for your breakout groups, and this is why you want to note which breakout group you're in. So if you're in breakout group 1, if you have any major questions or concerns to share with us as facilitators of the Health Foundation, you can just type them here. So you'll see that there'll be a space for that. So we'll be able to follow up after the event with any major questions or concerns you have when it comes up. We're not asking you to take copious notes when you're in your group. It's really, if anything, any major red flags or any really major questions come up while you're discussing. Please note that we will have facilitators just popping in. So Innovation Network and AD Solutions may just pop into your small breakout group while you're going, but we won't have an official facilitator in there. So it'll be up to you as a small group to introduce yourself and discuss those questions. If you have questions, please go ahead and type them in the box or in the chat box as we go. So you're going to be put into your breakout group now. Remember, note your number and follow the instructions on the guideline. And it'll say right when it invites you to a breakout group, it'll tell you which breakout group you're going in. So it'll say join breakout group 1 or 2. So you'll see it right then and there. Welcome back. All right, looks like we have our group back. Excellent. Thanks so much for everyone for the opportunity to discuss these important topics within your small group. It was really fun to watch you typing in your comments into the discussion form. If you weren't able to quite finish up all your conversation, this discussion forum will remain open. If there's a few more questions or comments that you want to type into the document, please feel free to. We will be looking through these to note any major themes or things we need to follow up with from the group. We did want to let you know that we will be sharing the full report from the ecosystem survey findings that has all the details on who participated and all the different aspects of that. There was also a question about some qualitative information from this as well, and the full report does have some information from open-ended questions in that full report as well. So if you want to dig in even deeper, we will be sending that full report right after the event. There's also a link that will where you can provide feedback on other things that you'd like to know about the ecosystem. So if you want to dig in a little bit deeper and let Innovation Network know more, please feel free to fill out that feedback form with some open-ended questions on your needs. So again, feel free to fill out that form if you need. Health Foundation staff, anything you'd like to add about anything that you saw from the comments within the group?
Hi, everyone. This is Kyle again. First of all, I just want to say thank you for with seems to be like a rich discussion that you all had in your breakout groups. I hope you enjoyed getting a chance to do some sense making with colleagues of yours about what you saw in sort of this snippet of a much larger set of data as well. We took a peek at the Google Doc comments that you were typing in there as they were rolling in and all that, and it sounds like a lot of the things that were striking you in the data were things that we noticed in it as well. And frankly, you all are the first external audience that's gotten a chance to look at this mountain of data that we got back from listening to you all on the ecosystem survey too. So we've been sort of waiting with bated breath to see what strikes you all as interesting, as important in what you saw in the data as well. So we're going to take some time with the comments that you put in the Google Doc to hear your reflections on it as well. But feel free to be in touch with me or my colleagues at the foundation if you have more questions about what you saw in the data from the survey, or if upon sleeping on it and all that, you have other things that sort of strike you in terms of the data or the patterns that you saw from the ecosystem survey.
Oh, Kyle, you just hit mute somehow.
Sorry, Zoom fail. In the chat box, I gave you all sort of like a cheat sheet about who at the foundation to reach out to if you have sort of specific questions about different topics. So if you have questions about your specific funding, the grant that you have from the Colorado Health Foundation, your best bet is always to start with the program officer that you've been working with in the context of that grant. They're all wonderful, lovely people and all that. So feel free to be in touch with them about any questions that your organization has about your grant. We were talking earlier in the overview about the exciting public opinion research work that we're doing to sort of dive into the mindset of people in Colorado and to really reflect on that and to translate that into effective messaging for different advocacy work. And there were a couple of questions that folks submitted in the chat box about like mask mandates and those kinds of things. And we know that you all have like really great questions, really great ideas where that kind of tool, that kind of capacity could be potentially really helpful. Your best person to reach out to at the foundation about that stuff is my colleague Jace Woodrum, who's coordinating all that work on our end as well. So if you have questions, ideas, suggestions, or wondering like if anybody's looked into certain things and all that, Jace lives and breathes that stuff all day, every day. So he's a great sort of source of information to reach out to. And as a general reminder to you as well, if any of you are planning to use any of your own funding that you have from the Health Foundation or other sources to commission research along those lines, Jace is always available just as a thought partner for you. So for example, like if you say like, we want to really look into this and we just don't know like which kind of researchers even could help us with this kind of question or something like that, Jace is a great thought partner if you're interested in doing any of that work on your own as well. And finally, if you have any just sort of like general questions about anything that you heard about today, things that you're wondering about the advocacy work of the foundation, wanting to go deeper about what you saw in the ecosystem survey results, what we're doing next with that on that front, feel free to reach out to myself or my colleague Scott Downs, who you heard introduce himself at the top of the call as well. And we're happy to, if we're not the best people to answer your questions, make sure that we could connect you to smart people who can. So I think that's it from my end, unless there's other things that come in, and feel free to use the chat box and I'll keep an eye on that if there's anything that you're wondering.
Thanks, Kyle. That's great. We did have a couple questions come in on the chat about the deadline for filling out more in that feedback form. If you could fill your comments out by the end of the week, that would be great. Then we can synthesize that and share with the Health Foundation and send follow-up as appropriate. And also, Jace has been super helpful, so that's awesome. And we will be sharing the contact information for the full group as well. Okay, so yeah, and sorry for those folks who maybe didn't get to wrap up with their small group fully. I've been in many of those small Zoom breakouts where it's giving you the countdown and you just want to finish up your conversation. So sorry if you didn't get a full wrap up. But there will be other opportunities to connect with the advocacy group in the coming months. So we're going to have 2 convenings planned for the fall. One will be a strategy session, which would really be more where advocates like yourselves are coming together around a topic to talk about how you might want to work together to make a change. And so those are really going to be more action oriented. And we're going to give those a try this fall. We're also going to have an opportunity for a skill building session, which is really more like your traditional professional development where you're learning about a specific topic with your colleagues as well. You'll have some opportunity for interaction, but it's really more that learning kind of session. Those will be held September 15th and December 8th. When we have more information, we'll be sending out invitations for those. So what we're going to do for closure now, and to help us to think about what those topics would be for the strategy and skill building session, we're actually going to have you fill out an event feedback form. So this form is going to do two things. One, it's going to give us feedback on the event today. So you'll have some Likert scale or linear scale questions that we're going to have you answer. And then there's also an opportunity for you to pick 2 topics that you think you would like to discuss this fall. And we'll use other data sources to determine what those topics are, but we thought we'd give you an opportunity here as well. And there is also a box in the feedback form that will ask if you want to help to plan those. So if you want to, just enter your name and email. So right now that's in the chat box. So if you click on the chat box, you'll see there's a link that says topic survey. If you go ahead and click on that, please fill out the event feedback, select your 2 topics, and let us know if you're interested in helping plan. If you have questions, type them in the chat box. And we've got our first response in, very exciting. We're up to 15 responses. Good job, team. All right, we're up to 28. We'll wait a little bit more to get a few more in. Okay, I think we have almost everyone, so we'll feel free to keep continuing to fill it out if you would like. So our real-time findings here right now of the topics that would be most interesting for the fall convenings, definitely the highest number we have here is issues related to racial equity. So that's our top one. And then second one was civic engagement and community voice. And then it looks like our third one was related to persuasive messaging and communications. So we'll look through those results as well as some of the open-ended feedback and then other data that we've collected from advocates, but this gives us a good kind of sense of the pulse on what people are looking to talk about right now, and none of that's surprising, so we're happy that that's kind of confirmed with what we're looking for. All right, do you want to go to the next slide? All right, so again, as we mentioned, right after this event by tomorrow morning, we're going to send you a follow-up email, and there will be a web link that has information that has the full ecosystem report, the recording of this meeting, as well as that ecosystem feedback form. You again will have till the end of the week if there's additional comments that you want to put into that small group discussion form that we were using. We know this went faster than we probably anticipated an hour-and-a-half Zoom meeting would go. And hopefully the small breakout groups made you excited for our next opportunity to come together, which will be in September, which will be right around the corner. Our final thoughts is we just wanted to share this quote from CDPHE's Office of Health Equity. We must look beyond our worlds, our own worlds. Working towards equity means understanding how our actions and policies impact communities unjustly. It means joining forces with and standing up for peoples oppressed across the world. After all, we create more impact when we do so together. We really enjoy doing these meetings because of the great energy that you bring when you come together. So thank you for all you do. We really appreciate it. Thanks to the Health Foundation staff, Innovation Network, and all of you who participated today. We're looking forward to our next convening in September. Have a wonderful day.